Element 7, Chemical and Biological Health Hazards and Risk Control. A factory uses small quantities of various toxic chemicals which re-obtained from and returned to a central storeroom. Possible routes of entry of toxic substances into the body, and in each case, describe a circumstance in which the storeroom staff might be at risk of such exposure. Ingestion. The substance is taken in through the mouth and swallowed down into the stomach and then moves on through the digestive system. This is a less significant route of entry since people are unlikely to deliberately swallow a hazardous substance. Ingestion usually occurs by cross-contamination of the hands by a toxic substance, or by mistaken ingestion. Absorption through the skin. The substance passes through the skin and into the tissues beneath and then into the bloodstream. Only some substances, for example organic solvents, are able to permeate the skin in this way, but when they can, this route can be very significant since any skin contact allows absorption. Injection through the skin. The substance passes through the skin barrier either by physical injection, for example a needle stick injury, or through damaged skin, cuts and grazes. This route is significant for many biological agents, for example hepatitis. Inhalation. The substance is breathed in through the nose and mouth and down into the lungs. This is a significant route of entry for many hazardous substances in the gas, vapor, mist, fume or dust form. People have to breathe. If the hazardous substance is present in the air around them, then it will be inhaled. Dust can be inhaled through the nose and mouth in this way, but not all dust will travel down into the lungs. Dust is made up of small particles of various diameters. Large dust particles are filtered out by the lungs' defense mechanisms before they can travel down into the lungs. Smaller particles are not trapped by these defenses and will travel deep into the lungs. B. Identify the factors to consider when assessing the health risk to storeroom staff from handling the chemicals. The hazardous nature of the substance present. Is it toxic, corrosive, carcinogenic, etc.? The potential ill health effects. Will the substance cause minor ill health or very serious disease, and will these result from short-term or long-term exposure? The physical forms that the substance takes in the workplace. Is it a solid, liquid, vapor, dust, fume, etc.? The routes of entry the substance can take in order to cause harm. Is it harmful by inhalation, ingestion, skin absorption, etc.? The quantity of the hazardous substance present in the workplace, including the total quantities stored and the quantities in use or created at any one time. The concentration of the substance, if stored or used neat or diluted, and the concentration in the air if airborne. The number of people potentially exposed and any vulnerable groups or individuals, such as pregnant women or the infirm. The frequency of exposure. Will people be exposed once a week, once a day or continuously? The duration of exposure. Will exposure be very brief, last for several hours or last all day? The control measures that are not already in place, such as ventilation systems and PPE. C. Identify the control measures that might be required in order to minimize the risk to the health of those working in the storeroom. Minimization of emission, release and spread of hazardous substances through design and operation of processes and task activities. Effectiveness and reliability of control options that minimize the escape and spread of hazardous substances. Exposure control to be proportional to health risk. Personal protective equipment, PPE. Other PPE and clothing. Personal hygiene and protection regimes. Health and medical surveillance. 2. Identify possible routes of entry of biological organism into the body. Mother to child. Interchanging of body fluids. Ingestion. Injection. Inhalation. Absorption. 3. Outline control measure that could be used to reduce the risk of infection from biological organisms. Sterilization and disinfection. This process removes the biological agent and therefore the hazard. It is often used to treat wastes to make them safe for disposal. for example treatment of used laboratory equipment, contaminated medical supplies, etc. Disinfection of workrooms and benches is an important control to minimize the spread of infectious materials. PPE can be used to prevent contamination of clothing, for example lab coats, or to prevent materials entering the body, for example respiratory and eye protection to prevent entry via inhalation or absorption, gloves to prevent contact with broken skin. Those handling biological agents should ensure that open wounds are covered at all times. The use of microbiological agents can often be restricted to a designated area, for example the use of microbiological safety cabinets, similar to laboratory fume hoods in principle but filtered to prevent the escape of agents, is commonplace. However, if the agent is on a host, such as an animal, then quarantine areas may be needed. Spill containment methods which prevent release of agents are required. Spill trays may be used in laboratories, whilst uncontrolled releases of, for example, body fluids such as blood may be treated with a chemical to contain and disinfect. High standards of personal hygiene are essential. Smoking, drinking, eating and applying cosmetics should all be banned in the workplace, and clothing should be changed, for example lab coats removed, before entering uncontaminated areas. Finally, vaccinations may be used to prevent infection in some instances, for example the hepatitis B vaccinations for first aiders already mentioned. 4. A worker is engaged in general cleaning a large veterinary clinic. A. Identify 4 specific types of hazard that the cleaner might face when undertaking the cleaning. 4 specific types of hazards can be: cleaning workers are at risk of exposure to zoonoses, infectious diseases that spread from animals to humans. Possible routes of transmission include aerosol, droplet spray, ingestion, oral, direct contact, indirect contact. Sources of exposure include animals, body fluids, contaminated tools, surfaces, or other objects in the environment. Cleaning workers are exposed to additional biological hazards especially from the animal droppings which may contain a contagious disease. Different chemical hazards including glutaraldehyde and other disinfectants, hazardous drugs, latex, pesticides, and waste anesthetic gases exist in the veterinary clinic. Exposure to these chemicals may occur by dermal contact and/or inhalation, being breathed in. Workers may be exposed to blood-borne pathogens while cleaning the blood of animals. Additional hazards may include slip while cleaning the biological and/or chemical spills. B. Outline the precautions that could be taken to minimize the risk of harm from these hazards. Following precautions can be adopted at a workplace. Personal hygiene practices are the best way to protect the workers from exposed hazards. Hand washing routines and use of hand sanitizers to be made part of workers' daily job routines. Double bag all the chemical waste, partially filled vials, undispensed products, needles and syringes, gloves, gowns, mats and contaminated materials from spill cleanups and animal bodily fluids. Prohibition of eating, drinking and smoking in the workplace. Health surveillance of the workers to be carried out for health monitoring and biological monitoring. Sterilization to be carried out to treat wastes to make them safe for disposal. Disinfection to be carried out immediately for the workroom and benches to minimize the spread of infectious materials. Vaccinations may be used for the workers in some instances, for example hepatitis B. Post the sign to warn employees that they are working in an environment where hazardous drugs are being handled. Train workers to recognize and understand the risks of working with hazardous chemicals used as drugs and the biological hazards they are going to face while cleaning. Training for the use of spill kits followed by the mock drills for the spills at workplace to make workers trained how to deal with the spill. Cleaning workers should be part of the dedicated team who carry out the spillage control at the workplace. Use of proper personal protective equipment which include but not limited to specialized gloves, safety shoes, only for cleaning not to be worn outside, coveralls, safety goggles, hairnets etc.